Please note that the information on Retire Vivid referenced in this video is accurate as of December 20th, 2024. Changes to laws and regulations may make portions of this segment outdated and no longer relevant. Information presented is for educational purposes only and is not intended to provide investment, tax, or legal advice. Please see our full disclosure at the end of this video.
Have until May 31st to enroll for Medicare medical insurance.
Medicare open enrollment runs through December the 7th.
Medicare price negotiations.
For Medicare.
Medicare open enrollment begins today. We're answering your questions about what you need to know to enroll. So,
Medicare.
The Medicare program for our senior citizens is a great step forward in meeting one of the most critical needs that confront most of our elder citizens. For many, it is a step from charity to security and dignity.
The Medicare program, as we know it today, insures over 60 million Americans, helping protect senior citizens from the financial risk that serious health issues pose. President Johnson signed Medicare into law on July 30th, 1965. Johnson traveled to Independence, Missouri, making former President Harry Truman and his wife Bess the first beneficiaries of the program. The gesture drew attention to the 20 years it had taken Congress to enact government health insurance for senior citizens after President Truman had proposed it. But in fact, Medicare's history dated back even further. When the program was first introduced, it was called Original Medicare, that covered only those 65 and older. It consisted of two parts, Part A and Part B. Medicare has seen many changes over the past 5 decades, including expanded coverage options, allowing more people to enroll, added protections for those Americans who use it, and increasing costs. Despite Medicare being a federal program, the system can feel confusing for even the most informed individual. Having a strong knowledge of the basics of Medicare and the costs involved can help you make a more informed choice to suit your healthcare needs in retirement.
Welcome to Retire Vivid. I'm Karen McCarty. That's Steve Burgett. And today's episode is on Medicare, the things that you should be looking at, the things you need to know. Because Steve, Medicare, it can be confusing.
It can.
I mean, for a lot of people, because there's all these different parts of Medicare.
There sure are. Yes, it is confusing to people.
You got A, you got B, you got C, you got D. It's just a lot.
Yeah.
But, before we get into it, I thought it was kind of fun. Our viewers just saw a video, and it was on the very first recipient of Medicare, and it was Harry Truman.
Yes.
Just walk our viewers through that real quick. I think it's such a cool story.
Yeah, it is a nice little story how that happened. It goes back to when Harry Truman was president. He tried during that time to go to Congress several times to get them to pass some kind of a nationwide senior health insurance program. And they talked about it, they debated it, but they never got it done while he was president. And then 20 years later, when LBJ was president, Lyndon Johnson, he was able to get that through Congress. They passed it and he signed it into law and they called it Medicare. And it was the nice thing that LBJ did at that time, he and his wife, Lady Bird, went down to Independence, Missouri, where Harry was living with his wife, Bess. And they did that so that LBJ could sit down with Harry and sign him up to be the first recipient of Medicare.
Yeah.
So they got together, they had a good old time down there, and they got that done, and Bess was signed up to be the number 2 recipient.
That's a really cool story. It's kind of fun how that all, came around. And so they called it Original Medicare.
They did.
And back then, it was just Part A and Part B.
That's right.
Right?
Yes.
And so, and now we've got other things that we'll talk about, but let's talk about Original Medicare, because I think people get confused just on that name, Original Medicare.
I've had people come in and say, I read if you have original Medicare, blah, blah, blah. What is that? Do I have original Medicare? Is that what I have? People do get confused about just the terminology. Well, the reason they call it original Medicare is because that is how it started originally, with just Part A and Part B.
And so there's Part A, that's hospital insurance.
Yes.
And then Part B, that's your medical insurance.
Yes.
So what does each side cover? And then also, what does it cost?
Yeah, well, hospital insurance, the Part A, is really what happens in the hospital. It's inpatient kind of things and stuff like that.
Yep.
And Part B is medical. They call it medical, but they mean non-hospital. And a lot of times it's outpatient things that happen and so on. And for Part A, there's no cost for most people. If people qualify for Social Security, they also qualify for Part A. For free.
Got it.
And for Part B, there is a premium for Part B that everybody has to pay a premium.
Yep.
It is means tested. So that means it goes up. The premium amount goes up as incomes go up.
That is called IRMA.
Well, yes.
Right?
Yes. Medicare puts out this chart called IRMA. It's income related monthly adjustment amount.
That's a mouthful.
Yeah. And but that chart shows people what your Part B premium would be, and also Part D. And actually, they look back 2 years to determine what your taxable income was, and then that decides or determines what your Part B premium is and your Part D premium.
Yeah, got it. Which is your drug plan, or is Part D.
Yep. Yes.
Okay, so let's talk a little bit about this in terms of when should I sign up for Medicare. I think there's a lot of water cooler talk where people say, oh, you're 65, you better sign up right now to avoid a penalty.
Yeah, well,
that's not true all the time.
Yeah, that's right. It's not always true. Medicare has a lot of enrollment periods.
Yep.
And the main one for most people is called the initial enrollment period. And that's around your 65th birthday, and 3 months before and 3 months after. And so that's when people can, and that's when most people do sign up for their Medicare.
Well, but you may not want to, right?
That's right.
There's a number of reasons.
Yes.
Let's first talk about this. Let's talk about credible coverage.
Sure.
Let's talk about that.
Medicare says if you have what they call creditable coverage at work, then you don't need to have Part B, not yet, until you lose that creditable coverage. Or A. Yeah, you don't have to.
Unless, we'll get into that. Keep going.
Well, yeah. With A, what comes into play is the HSA, the Health Savings Account.
Right.
Sometimes people have that at work and sometimes they don't. But if you have that at work, you don't want to sign up for Part A or for Part B, because then you have to stop your contributions. All your contributions have to stop once you are signed up for Medicare.
And that also includes your employer's contributions as well, too.
That's true.
And it could be backdated as well.
That's true, too, yes.
So again, be careful what you're listening to, and also be careful what you're reading.
Yeah.
I mean, again, if you're covered at work, you may not need to sign up for Part A.
That's right.
But if you don't have an HSA, then maybe sign up for it.
Sure.
Right?
Sure.
But if you are contributing to an HSA, beware.
Yeah, exactly.
Beware. I mean, the one thing is when it comes to Medicare, original Medicare, A and B, it doesn't cover everything.
That's right. A and B, your Medicare card with A and B on it is kind of like an 80-20 type insurance. So that means that Medicare would cover 80% of the cost, but the individual would still be responsible for 20%. But nowadays, people realize that 20% can be a lot.
It can add up.
Yes. And so that's why we do have other alternatives for people, other options for Medicare supplements and Medicare Advantage plans.
And I think that can also be confusing, because we're going to talk about that, where there's Medigap plans, right? Or supplements. There's Medicare Advantage plans, which is Part C. I mean, which one do you pick? Because people can be pretty passionate about this.
They can sometimes.
Well, we're going to go through that. We got a lot more to hit on, especially when it comes to filling that gap. Make sure you stay with us more right after the break.
Do you have questions about your retirement plan, or do you want to know if you are on the right track? We are here to help. Simply go to retirevivid.com. or call the number below to schedule a 15-minute retirement review. You can speak with us about taxes, Social Security, your 401k, or any quick retirement questions at no cost to you. We are here to make retirement vivid. Schedule your 15-minute retirement review today.
Welcome back. So we're talking about Medicare today. We just got done talking about Medicare Part A and Part B, which is original Medicare, but that doesn't fill the gaps. There's gaps that we need to fill. And so Steve, there's Medigap plans or supplements, and there's Medicare Advantage plans. Which one do you want? I mean, people got to choose a path. Which one do you want to go through first?
Well, we should talk about the Medicare supplements first, the Medigap plans, because they started first. They started in 1980.
Okay.
Yeah, and so when people choose a Medicare supplement, the first choice they have to make is all those alphabetical plans. There are really 10 of them. Plan A and B and G and F and M and N and different ones.
Yep.
And it doesn't just go straight through the alphabet because Medicare has discontinued some of those plans in the past.
Right.
But that's the first decision people have to make is which plan do they want? Which alphabetical number or letter do they want for their plan?
Now, when it comes to these supplements, when you first enroll, right, the first time you're eligible, the companies have to take you just the way you are, right? They can't ask you those medical questions, if you would, correct?
That's right, yeah. Those health questions, that they call them medical underwriting.
Right.
We think of them as pre-existing conditions, things like that. So when you're first enrolling, the companies can't even ask you those questions.
Sure.
Like, did you have a hip reeplasement, or did you have a heart problem, or did you have cancer, or anything like that?
They can't ask you those questions. Now, we'll get into why they may down here when we talk about the Advantage plans if you go back to a supplement. But they also kind of talk about, they sell these things as your plan travels with you.
Mm-hmm. Yeah.
Right?
Sometimes you hear that, yes. For the supplements, they'll often say that your plan travels with you. And what they mean is, if you're traveling throughout the country, you still have the same coverage wherever you go, just as you did when you were home.
Sure.
So if you have a plan, a Medicare supplement plan right here in Iowa, and you travel, let's say, to Arizona, your coverage is just the same as it would be here in Iowa. Right. No difference.
Got it. And then again, there's premiums involved with that. Mm-hmm. But that also, and we'll get into this, unlike the Advantage plans, it doesn't include Part D, correct?
That's right.
That's an add-on that you would have to add.
That's right. When you get that supplement, then you also have to get a Part D for your prescriptions.
Okay.
And so, because it doesn't come with the supplement. So you pay a premium for both of those things.
Let's move on to Advantage plans. So when did those come around?
Well, it was 1997 when Medicare actually created Part C, and that created the Advantage plans. Mm-hmm. So on your Medicare card, you have just A and B, and that's all people will have on their Medicare card. But there's also Part C and D, and Part C are the Advantage plans. So that's another option for people. Sometimes people choose a supplement, sometimes they choose an Advantage plan. If you choose an Advantage plan, then usually you don't have a premium to pay for that Advantage plan.
Okay.
And usually those plans also include Part D for your prescriptions.
So it's kind of like a buffet in a way versus a la carte when it comes to the Medigap plans.
Yeah.
But let's talk about the whole network thing.
Yes.
Right?
Yes.
In-network versus out-of-network.
Yeah, sure. So the supplements are not network plans. And that's why your plan travels with you wherever you go. With the Advantage plans, they are network plans like HMOs, PPOs, that kind of thing.
Yep.
And a lot of people are familiar with that because they have those kinds of things at work. They have a group plan that might be an HMO or a PPO. And so that's another choice they have when they go on Medicare. They can get an Advantage plan that's also a network plan. But that means you have in-network coverage, and when you're out of your network, it's out-of-network coverage. You still have coverage, but it's out-of-network coverage when you're traveling.
I want to address this real quick because you just said no premium.
Yeah.
Okay.
Yeah.
I mean, how does that work? Because I think, because here with a supplement, you're going to be paying a monthly premium, right? Because, what's your maximum out-of-pocket costs, right?
Yes, yes.
And then how does that work with the Advantage plan?
Yeah, well, that's a good question because a lot of people ask that very same thing. How can I have a plan
and not pay for it?
And not pay for it, yes.
It sounds too good to be true, Steve.
I think in Iowa, we're used to paying for our stuff, and we wonder how in the world does that work? Well, what happens really is you're not paying any premium monthly, but as the year goes along, you could have some costs. You could have some costs, for example, if you had surgery of some kind, or if you were in the hospital for something, you would have some portion of that as a cost.
Sure.
And so because of that, all of the Advantage plans do have to have a maximum out-of-pocket.
Okay.
That's what they call it. And that just means the upper limit of what you might have to pay during that year. And those maximum out-of-pocket amounts are right around $4,000. Some of the companies are a little over $4,000, some a little under $4,000, but roughly $4,000.
And there's also all these perks, right?
Yeah.
Everybody's trying to sell you a Medicare plan. Another thing I wanted you to bring up too is when people approach 65, it's like hunting season. Right?
Yeah.
I mean, I feel bad for you folks. I really do.
Yeah, you get so much stuff in the mail.
So much stuff. I mean, what should people be looking for?
Medicare is run by CMS. CMS is actually Centers for Medicare and Medicaid Services.
Okay.
So sometimes you'll get something in the mail from CMS.
Yeah.
And they're not trying to sell you anything. They're just giving you information about Medicare. So that's worth taking a look at. But so much of the other stuff is marketing material, and they're just trying to sell you their plan.
They're trying to sell the plan. So, but CMS, I mean, because again, that's why I want you here. I mean, this is for education because people just need to be educated about what their options are. One quick thing too is, let's say that you had a Medigap plan. Mm-hmm. You talk to your best buddy and say, I got an Advantage plan. You go over there. They still can't ask you those questions.
That's right.
But then let's say you go, this really isn't for me, and I want to go back to Medigap.
Yeah.
Can they ask you those questions now?
Yeah, that can happen. So down the road, if you're switching your plan and you're going to a Medicare supplement, same thing as a Medigap plan, then that company that you're trying to go to can ask you those questions, those health questions, those medical underwriting. And that can have an effect on your premium that you might have to pay, and also whether you can even get into the plan or not.
And so, Steve, that's also why we offer that 15-minute retirement review. This is where our viewers have the options where they can give us a call. And again, and ask us those questions. They can ask you these questions when it comes to Medicare. I mean, some people just have a quick question. That's fine.
Sure.
And so, again, I encourage everybody to take advantage of that. And I do believe it's been very helpful.
Yeah, I know people have a lot of questions, and we're always welcome to listen to those and help them with those questions.
Absolutely. Okay, so we got more to talk about. I mean, I'm going to talk about some pitfalls. I'm not done with you yet. I got a lot more to go through with you.
Okay.
I want to talk about Part D and what that means for our viewers. We got all of that next, right after the break. Okay, let's wrap up Medicare. So we just talked about a lot today, and I know sometimes it can feel clear as mud, but again, that's why we're here doing this show, right? You're here to help people, no different than anybody else out there. So I want to talk about Part D, okay? We touched on it, but we really didn't dive into it, and so Part D is your prescription plan.
That's right.
And another thing I want to talk about, the penalties. We didn't talk about the penalties yet. I want to touch on that, but let's first start on Part D.
Well, a Part D is just for your prescriptions, and all the Part D plans have a formulary.
Yeah.
And they just mean a list of all of the drugs that they cover in that plan. And so we look those up to make sure somebody's drugs are covered in the plan they're signing up for.
Sure.
And it'll show the drugs in the formulary, and it'll show them as tier 1, 2, 3, 4, and 5.
Sure.
And tiers 1 and 2 are usually the least expensive drugs, and they're usually the generic ones. But sometimes people have drugs that are in tier 3, 4, and 5, and those do get more expensive.
Let's kind of bridge that into penalties real quick, because we really haven't touched on that yet. So when it comes to penalties, again, we talk about when you're first eligible. And let's say that, again, if you're past 65, but you're on your group health care plan, credible coverage, we're good. But if you fail to sign up for Part B, what are you penalized?
Well, if you fail to sign up when you're first eligible, that's how Medicare looks at it when you're first eligible. Then when you sign up later, you could have a penalty from Medicare.
Unless you have credible coverage.
But when that creditable coverage ends, then that's when Medicare considers you first eligible.
There we go.
And then if you don't get signed up then, but maybe a year later you remember and you decide, hey, I better get signed up, well, Medicare will say, fine, but when were you first eligible? And so then you would get a penalty. And for Part B, the way they figure it is you pay an extra amount on your premium. It's an add-on to your premium of 10% for every 12 months that goes by that you did not sign up when you could have.
Okay.
So an extra 10%. And the way that they do it for Part D is a little different, because they do 1% for every month that goes by when you didn't sign up, but you could have.
Okay, let's talk about that for a second, because some people, this is a good one right here. So let's just say, a person that you met with and they said, Steve, I don't got any prescriptions. Why do I need Part D? Fine, it's your choice, don't take it. Let's say you're 65 when you did that. 10 years down the road, you're now 75. Now you have prescriptions.
Yes.
You say, hey, Medicare, I want to get my Part D plan. They'll say, okay, but
yes, when were you first eligible?
When were you first eligible?
And that's when you would get that penalty that we talked about.
Let's put that in perspective.
Yeah.
So you said 1% per month.
Yes.
Times 10 years.
Yeah.
Is it a slap on the wrist and you're done?
No, not really. It'd be better for a lot of people if Medicare just fined them or penalized them $50 or something, and
that's not how it works.
They'd be done. But no, you're not done, because they add on to the premium. And so how long is that going to last? Well, that's going to last the rest of your life. You're going to have Part D and you're going to have Part B the rest of your life. And if you're paying a premium, that premium continues.
Right. So it may make sense just to pick it up.
It does make sense.
It may make sense to pick it up. Okay. Wait, there's more. I'm not done yet with you. I want to talk about some pitfalls. Okay. And then I want to wrap up with this. So we talked about a lot of it, but I want to just kind of do a quick one here and just kind of go through it. So this is a good one here. So here's a pitfall. Getting a penalty for, we just kind of talked about this, for not enrolling when you're first eligible.
Yeah.
And so that's when you were talking about the 10% for Part B.
Yeah.
And then 1% for Part D. So we kind of already hit on that.
1% every month, yes, that's right.
We kind of already hit on that. Okay. How about this one? Enrolling in a plan does not include your doctor in the plan's network.
Yeah, and that comes up once in a while, sometimes when people are enrolling in an Advantage plan, which are network plans, and that would be fine, but not if your doctor's not in the network that the plan is in.
Right.
So you do have to be careful about that.
Another pitfall, getting a Part D, which is the prescription plan, that does not include all your prescriptions in the formulary.
You want to make sure that your drugs are included in the formulary for your Part D. Yeah, so I help people look those up sometimes when they want me to do that, and we make sure that their drugs are included.
We already talked about the HSA in terms of why you may not want to sign up for Part A if you're still working, right?
Yes.
Because we don't want to lose all contributions, employer contributions to an HSA. That's a mistake. Beware of that.
Yeah.
Well, how about this one? Using a doctor who opts out of Medicare. That's a big one.
It can be. There still are some doctors who opt out of Medicare. That means they just don't participate in Medicare. Medicare says it's 1.1% of all doctors across the country who do not participate in Medicare.
Sure.
So it doesn't happen very often, but you could run into that. You could maybe go to a specialist for something, and you find out that they're not participating in Medicare. So in those cases, they don't submit things to Medicare. They just charge you what they charge you, and it's just you pay them directly, and it doesn't go through Medicare.
And I think the other thing too, Steve, is it's important to understand that Medicare doesn't, assuming that it pays for your long-term care costs.
Right, it does not.
It does not.
Sometimes people think that, though. They think, well, I have Medicare, so I don't need to worry about long-term care. Well, long-term care really is considered custodial care. Right. And Medicare does not cover that.
I mean, I could keep going. I mean, there's so much to talk about when it comes to Medicare. I mean, because again, it's such a big decision that people have to make, and just trying to make sense of all this. And you do such a good job of going through it. So I appreciate you doing that.
Well, hey, glad to be here.
Yeah, absolutely. So again, folks, I hope you learned something today. I mean, we are here to help you. I mean, that's the whole purpose of this show, is to give you guidance, to give you things to think about when it comes to your retirement journey. And remember, we're on every weekend, so make sure you tune in. We'll catch you next time right here on Retire Vivid.
Cameron McCarty is an investment advisor representative of Vivid Wealth Management, SEC registered investment advisor located in Des Moines, Iowa. Investment advisory services are offered through Vivid Wealth Management, LLC, a registered investment advisor. Insurance products and services are offered through Vivid Tax and Wealth Advisors, and individually licensed and appointed agents. Tax planning and preparation services are offered through Vivid Tax Center, LLC. Vivid Wealth Management and Vivid Tax and Wealth Advisors do not provide tax or legal advice. Vivid Wealth Management, Vivid Tax and Wealth Advisors, and Vivid Tax Center are affiliated companies. Vivid Wealth Management, Vivid Tax and Wealth Advisors, and Vivid Tax Center are not affiliated or endorsed by the Social Security Administration, Centers for Medicare or Medicaid Services, or any government agency. Steve Burgett is a licensed insurance professional with Insurance Plus LLC. Insurance Plus LLC is not affiliated with Vivid Tax Center, Vivid Wealth Management, and Vivid Tax and Wealth Advisors. Information presented is for educational purposes only and does not intend to make an offer or solicitation for the sale or purchase of any specific securities, investments, or investment strategies. The presented opinions and information are not intended to provide health insurance, investment, tax, or legal advice. All information provided is deemed reliable, but is not guaranteed and should be independently verified. Case studies and examples presented are hypothetical and used to demonstrate a concept. These studies do not represent actual clients or results. Similar or even positive results cannot be guaranteed. Past performance is not indicative of future performance. Therefore, no current or prospective client should assume that future performance of any specific investment strategy, including the investments and/or investment strategies recommended by Vivid Tax and Wealth Advisors, or product referenced directly or indirect, will be profitable. Different types of investments involve varying degrees of risk, and there can be no assurance that any specific securities, investments, investment strategies, or services discussed will be suitable for any investor. Be sure to first consult with a qualified insurance agent, financial advisor, tax professional, and/or attorney before implementing any strategy discussed herein.